Well, my friends, this is a case I do like to demonstrate about the colon cancer. You know, this is the mouth cavity, this is the esophagus, this is the stomach, and this is the duodenum. Just below the stomach, it begins duodenum, then the jejunum and ileum, and when it ascends, it's known as ascending colon. When it transverses, known as transverse colon. When further descends, descending colon, pelvic colon, the lowermost part, and the rectum and anal canal. There is cancer as tendency in the colon, especially in the large gut, ascending colon. So colon cancer nowadays has been increasing very much. It means growth of the cells in a part of the large intestine. Large intestine means from the cecum where the ileum ends and the big pipe begins, known as ascending colon. It generally occurs in the ascending colon. So in the large intestine, it is called the large intestine. It usually occurs in middle-aged persons or elderly persons, but can also arise in younger people too. The rectosigmoid region is the main site for the colon of CA. This is the rectum and this is the sigmoid colon. This is the main site. The colon cancer, it may appear in ascending colon or sometimes in the transverse colon or descending colon. But the main site clinically we have observed, we have found, and it has been mentioned in the clinical surgery that it is mainly found, it mainly occurs at the junctions of the rectum and the pelvic colon. It is gradually increasing and it is very common in the meat eaters, especially the red meat eaters. It usually begins as small clumps of cells like polyp, like rectal polyp. Many polyps generally are not cancerous, but some can turn into the cancers. It is a very slow growing tumor. It is a very insidious growing tumor and spread mostly by the direct infiltration. Colon cancer is sometimes called colorectal cancer. অনেকে বুঝতে পারে না যে কোলোরেক্টাল বলছে কেন, colorectal CA, when the cancer begins in the rectum. Many people with colon cancer do not have symptoms at first, but later symptoms appear like change in the bowel habits, frequent diarrhea or constipation, or diarrhea and constipation alternately. This is the first and usually progressive and determinative symptoms, my friend. And there is rectal bleeding. Sometimes the blood in the stool is the second most important symptom. Please remember, my friends, patient often considers the passage of blood per rectum to be due to piles. But unfortunately, their long consideration, the diagnosis becomes delayed and cancer of the colon goes in the advanced stage. ডাক্তারবাবু কী হয়েছে? আমার অর্শ হয়েছে, আমার রক্ত পড়ছে, একটু অর্শের ওষুধ দিন না। Actually, he is a victim of colon cancer. In some patients, the first sign may be acute intestinal obstruction, a feeling that the bowel does not empty all the way during the bowel movement. However, we have enough scope for this colon cancer treatment. This is a gentleman, aged about 76 years, has been suffering from colorectal carcinoma. Chemotherapy already done, 6 cycles of chemo he had already received. There are some comorbidity symptoms. He is having diabetes mellitus and hypertension, on which he is medication for the long period of time. So there are 6 cycles of chemotherapy already done, had generalized weakness and exertional dyspnea. So our treatment on the basis of symptomatology and constitutional, and by the constitutional mode of treatment, I have selected the medicine is solubilities. Because the tongue large and salivated, there is profuse salivation, first class, stool shock, etc. the symptoms. I had prescribed MS 1, 2, 3, 4, 5, 6 with the direction thrice in a day, and today is the second visit. The patient has improved a lot. The bleeding is stopped. I do not like to show the face of the patient, but the patient is slowly improving. আপনি মুখ দেখাতে চান না তো? মুখ দেখাতে চান না তো? আপত্তি নেই তো? তাহলে ভালো। So he is interested to show his face. He has no birth. So I am showing the patient. This is the gentleman already suffering and had taken 6 cycles of chemotherapy, and now at my hand, at my own observation, and he is feeling better. একবার মাত্র ওষুধ দিয়েছি আপনাকে, ভালো আছেন, ভালো বুঝছেন, অনেকটা ভালো আছে। So post chemotherapy treatments in the colorectal cancer are also the stages of homeopathic treatment, my friends, and I do hope the gentleman will slowly, gradually and insidiously improve. Thank you very much.